View women's health, an important hidden cause. Behind PCOS, breast cancer, and cervical cancer. Opening. Good morning, everyone. Today, I am not here to frighten you. I am here to empower you. We will talk about 3 common conditions affecting women: PCOS, breast cancer, cervical cancer. At first glance, they seem very different, but today I want to reveal something important. There may be one silent underlying factor connecting them: insulin resistance. Don't worry if the term sounds medical. By the end of today, you will understand it clearly, and more importantly, you will know what to do about it. Part 1. Understanding insulin resistance before diabetes appears. Before we talk about PCOS, breast cancer, and cervical health, we must understand something very important. Most people think metabolic disease begins when blood sugar becomes high. But that is not true. Long before diabetes is diagnosed, there is often a silent stage called insulin resistance. In this stage, blood sugar may still appear normal. HbA1c may still be within range. The person may not feel any symptoms, yet internally, the body is already struggling. The pancreas is producing more and more insulin to keep blood sugar under control. Blood sugar looks normal, but insulin levels are elevated. This stage can last 5 years, 10 years, sometimes even longer. And during this silent phase, inflammation increases, hormonal imbalance develops, fat accumulation progresses, PCOS risk rises, cardiovascular risk increases. So insulin resistance is often present long before diabetes is diagnosed. Why is it less commonly detected? Modern medical systems are excellent at diagnosing diabetes. We measure fasting glucose, HbA1c, oral glucose tolerance test. But insulin levels are not routinely tested in many settings. Why? Because diabetes is easier to define clinically. Insurance and public health programs focus on glucose thresholds. Screening protocols are built around diabetes criteria. It is not that doctors are waiting for diabetes. It is that our diagnostic systems are structured around glucose, not early metabolic imbalance. That distinction is important. The silent phase of insulin resistance. During insulin resistance, the body compensates. Insulin rises. Glucose remains controlled. This compensation masks the problem. By the time blood sugar rises, the metabolic dysfunction has often been present for years. That is why early awareness is powerful. Can insulin resistance be tested? Yes. Tests that can give insight include fasting insulin level, HOMA-IR calculation, fasting glucose to insulin ratio, triglyceride to HDL ratio, indirect clue. These are not always done routinely, but in high-risk individuals, they can be useful, especially in women with PCOS, abdominal obesity, family history of diabetes, irregular periods, early metabolic syndrome. A balanced perspective. This is not about criticizing doctors. Many physicians are deeply committed to prevention. But healthcare systems often respond to established disease. Public awareness of early metabolic dysfunction is still growing. That is why education matters. Diabetes is the visible stage. Insulin resistance is the silent stage before it. Prevention begins in the silent stage. That is powerful and responsible. Let us begin simply. Whenever we eat food, especially rice, bread, sweets, our blood sugar rises. Our body releases a hormone called insulin. Insulin's job is good. It helps move sugar from blood into the cells for energy. But what happens when we eat too much refined food? We sit for long hours. We gain abdominal weight. We sleep poorly. We live under constant stress. The body starts responding less effectively to insulin. This is called insulin resistance. The body then produces even more insulin. Now insulin becomes chronically high, and this is where the problem begins. What high insulin does. Insulin is not just about sugar. It also stimulates growth, increases inflammation, affects hormones, influences immune strength. High insulin over many years creates a body environment that is inflamed, hormone imbalanced, less able to fight infections, more prone to abnormal cell growth. Think of it like this. Insulin resistance changes the soil of the body, and disease grows more easily in unhealthy soil. Part 2. PCOS. PCOS is very common today. Many young women have irregular periods, acne, facial hair growth, weight gain, difficulty getting pregnant. Why? Because insulin is stimulating the ovaries. High insulin. Ovaries produce more male hormones, androgens. This leads to irregular ovulation, hormonal imbalance, cysts in ovaries. Here is the important truth. PCOS is often not just a gynecological problem, it is a metabolic problem. If we improve insulin sensitivity, periods improve, hormones stabilize, fertility improves, weight reduces. Many women think PCOS is permanent, but metabolic correction makes a big difference. Part 3. Breast cancer. Let us talk about breast cancer. First, understand clearly. Breast cancer has many causes: genetics, hormones, age, environmental factors. But metabolism plays a role too. After menopause, the ovaries reduce estrogen production. Now fat tissue becomes the main source of estrogen. More body fat, more estrogen. And high estrogen can stimulate certain types of breast cancer. At the same time, high insulin promotes cell growth, so in postmenopausal women, obesity, high insulin, hormonal imbalance, altogether increase risk. Again, not the only cause, but an important factor. Part 4. Cervical cancer. Cervical cancer is mainly caused by infection with a virus called human papillomavirus. Most women get this infection at some point, but in most women, the body clears it naturally. Why does it persist in some? Strong immune system, virus clears. Weak immune system, virus may persist. Insulin resistance reduces immune efficiency. High inflammation, high sugar, poor metabolism, all weaken viral clearance. So again, insulin resistance is not the cause, but it can make the body less able to fight the virus. Part 5. The common thread. Now let us connect everything. PCOS, breast cancer risk, cervical cancer progression, all influenced by high insulin, chronic inflammation, hormonal imbalance, reduced immune strength. This is the common soil. And here is the empowering message. Soil can be improved. Part 6. Prevention. What women can do. This is the most important part. Not fear. Action. 1. Maintain healthy weight. Even 5 to 10% weight loss improves insulin sensitivity dramatically. 2. Move daily. Walking 30 minutes daily helps. Strength training twice weekly is powerful. Muscles use glucose better. 3. Reduce refined carbohydrates. Avoid sweets. Avoid sugary drinks. Avoid ultra-processed snacks. Prefer whole grains. Vegetables. Protein. Healthy fats like olive oil, cold-pressed mustard oil, ghee, butter. 4. Sleep well. Poor sleep worsens insulin resistance. 5. Manage stress. Chronic stress increases cortisol, worsens insulin sensitivity. Breathing exercises. Meditation. Quiet time. 6. Regular screening. Very important. Pap smear. HPV testing. Mammograph, infrared, imaging for inflammation. Lifestyle supports. Screening saves lives. Emotional reassurance. Very important. This is not about blaming women. Cancer is complex. Not everything is controllable. But metabolic health is something we can influence. Even small improvements make big changes. Can energy medicine help? Before we conclude, I want to address an important question that many women silently carry. Can energy medicine help these conditions? It is a good question, and it deserves an honest answer. Let me be very clear and very responsible. Energy practices are not a replacement for medical treatment. They do not replace surgery, medicines, screening, or vaccination. But that does not mean they are useless. What energy practices actually do? When we speak scientifically, what people call energy medicine is often stress regulation, nervous system calming, hormonal balancing, immune support. Chronic stress keeps the body in constant fight or flight mode. In that state, insulin resistance worsens. Hormones become imbalanced. Immunity weakens. Healing slows. When we calm the nervous system, the body shifts into repair mode. This is not belief. This is physiology. PCOS. PCOS improves when insulin sensitivity improves. Stress worsens insulin resistance, so practices like meditation, breathing exercises, yoga, relaxation help by lowering stress hormones. They support hormonal balance. They do not cure PCOS by magic. They support the body's natural regulation. Breast cancer. Breast cancer treatment must follow medical science. That is non-negotiable. But energy practices help women cope with fear, fatigue, pain, sleep disturbance. A calmer nervous system supports better treatment tolerance, better immune balance, better quality of life. This matters deeply. Cervical cancer and HPV. HPV clearance depends on immune strength. Stress weakens immunity. Relaxation improves immune regulation. Energy practices support the terrain, not the virus directly. Screening remains essential. Vaccination remains essential. The right way to integrate. So the truth is this: medicine treats disease, lifestyle corrects metabolism, energy regulation restores balance. When used together, wisely and ethically, they create resilience. In addition to lifestyle measures and mind-body practices, there are emerging bioregulation technologies that aim to support autonomic balance and metabolic health. Modalities such as vagus nerve stimulation, VNS, heart rate variability training, pulsed electromagnetic field therapy, PEMF, infrared light therapy, and even hydrogen-based therapies are being studied for their potential roles in reducing neuroinflammation, modulating autonomic nervous system imbalance, improving mitochondrial function, and lowering oxidative stress. While current evidence supports their role primarily in stress regulation, pain modulation, circulation, and metabolic support, and not as standalone treatments for cancer, they may help address internal neurodysregulation that contributes to insulin resistance. Where available and supervised by qualified professionals, such modalities can be considered as optional adjuncts within an integrated women's health framework. However, they should always complement, never replace, standard medical screening and treatment. Final message to every woman here. Your body is not fragile. It is intelligent. It responds to how you eat, how you move, how you sleep, how you manage stress, how regularly you screen. Prevention does not begin in hospitals. It begins years earlier, in daily choices. Small changes, sustained over time, reshape your internal environment. And that environment matters. Women's health is not only about treating illness. It is about creating conditions where illness struggles to grow. That is empowerment. That is prevention. That is real health. Thank you. Holistic Wellness Foundation. IMFEL. Healing Beyond Boundaries.